3 techniques that can save your life in a heart attack. My patient did it and survived. A sudden, crushing pain in your chest can strike at any moment, and the thought of being completely alone at home when it happens is a terrifying prospect. Your phone, perhaps just in the next room, might feel miles away. In such a critical situation, you could have as little as 8 to 10 minutes before irreversible damage begins to affect your heart. This urgency is not a mere exaggeration. It is a stark reality that underscores the importance of immediate action. A staggering 65% of individuals who unfortunately succumb to a heart attack do so before they even reach the hospital. The most tragic aspect of these statistics is that the vast majority of these deaths are not due to an absence of solutions or effective medical interventions, but rather a profound lack of knowledge regarding what crucial steps to take in those initial, life-altering minutes. In the following paragraphs, I will meticulously outline 3 specific techniques that medical professionals, particularly cardiologists, are intimately familiar with. Techniques that anyone, especially those over the age of 60, should commit to memory. These aren't theoretical concepts. They are real-world strategies that have saved actual lives, often in scenarios where no one else was present to offer assistance. Before delving into these life-saving methods, it's imperative to grasp a fundamental distinction. The vital information I am about to share with you today extends far beyond the generic advice found in typical doctor's pamphlets or the cursory explanations provided during a brief 5-minute consultation with your general practitioner. This is the kind of deeply practical, essential knowledge that I would personally impart to my own father, equipping him for the absolute worst-case scenario. Therefore, I urge you to remain focused and absorb every detail, because what you are about to learn could quite literally represent the critical difference between life and death. My name is Alejandro Gomez, and I have dedicated over 20 years to the practice of clinical medicine. My career has taken me through the high-stakes environment of emergency rooms, the intensive monitoring of coronary care units, and, regrettably, to countless difficult conversations with families who arrived too late. Their loved ones' outcomes were not sealed by the inevitability of the heart attack itself, but by the fact that the person experiencing it either did not know how to act, or worse, acted incorrectly. This is precisely what I am determined to change with you today. Allow me to share a deeply impactful experience from the early stages of my medical career. I vividly recall a patient, let's call him Manuel, a 68-year-old man, retired, active, and with no significant history of cardiovascular disease. He was the epitome of a conscientious individual. He regularly took his walks, maintained a healthy diet, and consistently attended his medical checkups. By all accounts, he was doing everything right. One Tuesday morning, his wife left the house to run errands, leaving Don Manuel alone. Approximately 30 minutes later, he began to experience an unsettling pressure in the center of his chest. His initial thought was indigestion or heartburn, a common misinterpretation. He decided to lie down on the sofa, hoping rest would alleviate the discomfort. When his wife returned an hour and a half later, she found Don Manuel unconscious. What could have easily been a heart attack with a full and complete recovery instead resulted in permanent cardiac damage. While he survived, his quality of life was irrevocably altered. What went wrong in this tragic sequence of events? It wasn't his heart that failed in the first instance. It was the absence of critical knowledge. Don Manuel simply didn't know what to do, and that crucial lack of information cost him a part of his heart forever. Don Manuel's case, I must emphasize, is not an isolated incident. It represents a widespread and alarmingly common scenario. According to the World Health Organization, cardiovascular diseases are responsible for the deaths of nearly 18 million people worldwide each year. Myocardial infarctions, or heart attacks, alone account for approximately 9 million of these fatalities. The statistic that most profoundly affects me as a medical professional is that over half of these individuals die before they ever reach a hospital. Furthermore, studies conducted globally reveal that the average time a person takes to call emergency services after the onset of symptoms ranges from a distressing 2 to 4 hours. 2 to 4 hours. This is an agonizing delay when, in the context of a heart attack, every single minute quite literally counts in seconds. Cardiologists frequently employ a poignant phrase, time is muscle. Each passing minute during a heart attack sees the heart muscle lose cells that are incapable of regeneration. These cells are gone forever. But today, we are going to interrupt this devastating cycle. We are going to equip you with the essential knowledge that will empower you to act decisively and correctly, even if you find yourself entirely alone. To truly comprehend the necessary actions during a heart attack, you must first understand the underlying physiological events unfolding within your body. Once the mechanism is clear, every subsequent piece of advice will logically fall into place. Allow me to use an analogy that I often employ with my patients, one that they consistently remember. Envision your heart as an immense, bustling city, populated by millions of tireless workers, the cardiac muscle cells, laboring diligently 24 hours a day, 365 days a year, without respite. For this vital city to function optimally, it requires an uninterrupted supply of essential resources, oxygen, and nutrients. These critical supplies are delivered via a network of specialized superhighways known as the coronary arteries. Now, consider what happens when one of these crucial arteries becomes obstructed. Over many years, an insidious substance known as atherosclerotic plaque gradually accumulates within the walls of these arteries. Imagine this plaque like the rust that slowly but surely builds up inside an old water pipe. It's a composite of cholesterol, inflammatory cells, and calcium, forming a hard, crust-like deposit along the arterial wall. For a considerable period, this plaque may remain stable, causing no discernible problems. However, a critical moment arrives when something destabilizes it. This trigger could be a sudden spike in blood pressure, an episode of intense emotional stress, or an abrupt physical exertion. When such a trigger occurs, the plaque ruptures. This is where the true drama begins. Upon sensing this rupture, your body interprets it as a wound and initiates its standard healing response. It dispatches platelets, which are essentially your blood's emergency repair crew. These platelets rapidly aggregate at the site of the rupture, forming a clot. The tragic irony is that this clot, instead of merely repairing the injury, completely obstructs the artery. At that precise moment, every tissue and cell previously nourished by that artery ceases to receive oxygen. The millions of cellular workers in that specific quadrant of your heart city are cut off from their vital supplies. Here's a crucial piece of information that very few people are aware of. The cells of the cardiac muscle begin to die in a matter of minutes, not hours. Within just 20 minutes of oxygen deprivation, the initial cardiac cells become irretrievable. At the 40-minute mark, the affected area of your heart muscle starts to expand significantly. After approximately 6 hours, without any medical intervention, a substantial portion of that tissue can undergo permanent necrosis. This dead tissue will never return. The heart lacks the regenerative capacity of other organs. What dies, dies forever. Now, with this understanding, you can truly appreciate why, when you experience the symptoms of a heart attack, every single second is literally cardiac muscle that you either lose or successfully preserve. The good news, and this is something I want you to etch into your memory, is that thanks to advancements in modern medicine, if swift action is taken, medical teams can open that blocked artery, remove the clot, and restore blood flow in less than 90 minutes from the moment you arrive at the hospital. This procedure, known as primary angioplasty, has the potential to virtually restore your heart to a healthy state. However, for this to happen, you first need to reach the hospital. And to reach the hospital, you absolutely must know precisely what to do in those initial, critical minutes when you are utterly alone. Now, let's move on to the 3 pivotal techniques. The first, and arguably the most crucial technique, which surpasses all others' immediate importance, is what I refer to as the 60-second emergency protocol. While it is not overly complicated, it involves a very specific sequence of actions, and adhering to this precise order can be the ultimate determinant between survival and a fatal outcome. Step 1. Recognize the symptoms and do not ignore them. This is, by far, the most frequent and most deadly mistake people make. The symptoms of a heart attack are not always the dramatic, debilitating events you might see portrayed in movies. The sudden, crushing pain that immediately brings someone to their knees. In many instances, particularly in individuals over 60 years of age, and even more so in women, the symptoms can be much more subtle and insidious, making them dangerously easy to dismiss. So, what exactly should you be looking for? Firstly, a sensation of pressure or heaviness in the center of the chest. This is not always an acute, sharp pain. Many patients describe it more as if someone is squeezing my chest with their hand, or there's a heavy slab on top of me. This type of pressure can persist for more than 20 minutes, a crucial indicator. Secondly, pain that radiates to other parts of the body. The most commonly recognized radiation is to the left arm, but the pain can also spread to the jaw, the neck, the back, or even the right arm. Don Manuel, the patient I mentioned earlier, recounted experiencing a dull ache in his jaw before he lost consciousness. This atypical presentation highlights the varied nature of heart attack symptoms. Thirdly, sudden and unexplained cold sweating. If you find yourself suddenly covered in a cold sweat without any apparent reason, you haven't exerted yourself, the room isn't hot, this is a significant red flag. Your body produces this cold sweat when your autonomic nervous system activates in response to cardiac distress, signaling a serious internal alarm. Fourthly, nausea or a feeling of dizziness. Many patients, especially women, report nausea as their primary symptom, often without any accompanying chest pain. They frequently misinterpret this as indigestion or a stomach upset, a truly terrible and potentially fatal error. If you experience sudden, unexplained nausea or lightheadedness, particularly with other accompanying symptoms, do not dismiss it. Fifthly, and perhaps the most difficult to precisely define, is a profound sense that something is profoundly wrong. While this may sound imprecise, cardiologists are well aware of what patients describe as vital anguish, an overwhelming and pervasive feeling of impending doom or death that the body itself generates. If you experience this inexplicable, primal fear, do not, under any circumstances, ignore it. It is your body sending a clear, albeit unsettling, signal. Now, I want you to engrave this critical guideline into your memory forever. If you are over 60 years old, possess cardiovascular risk factors such as hypertension, diabetes, high cholesterol, or a history of smoking, and you experience any combination of these described symptoms for more than 5 minutes, it is a heart attack until proven otherwise. Do not attempt to convince yourself that it's merely a muscle strain, heartburn, or stress. In medicine, we adhere to a fundamental principle. When in doubt, act as if it's the worst possible scenario, because if it truly is the worst and you fail to act, there is no turning back. Step 2. Immediately call 112 or your country's emergency number. This is, without question, the most critical step, and I cannot emphasize it. That one should lie down when feeling unwell. This instinct is understandable. When you feel sick, the natural inclination is to rest. However, in the context of a heart attack, lying flat on your back can actually increase the workload on your heart due to hemodynamic reasons. When you lie completely flat, the venous return of blood to the heart increases, meaning a heart that is already struggling has to work even harder to manage this increased volume of blood. The correct position is known as the modified Fowler's position, and it is very simple to achieve. Sit on the floor or in a sturdy chair. If you are on the floor, lean your back against a wall for support. Bend your knees and, if possible, elevate your legs slightly by resting them on something stable. Let your arms rest comfortably at your sides. This specific position significantly reduces cardiac preload, that is, the amount of blood the heart has to pump with each beat, and simultaneously facilitates easier breathing. Think of it this way. If your heart is a pump that is failing, would you overload it with work, or would you help it work as minimally as possible while the repair crew is en route? The answer is clearly the latter. Help it work as little as possible. Remain in this position. Make every effort to stay calm. Do not exert yourself. Do not attempt to walk to the hospital. Do not call 10 different people on your phone. Conserve all your energy for your heart. The second technique involves one of the most thoroughly studied and highly effective pharmacological interventions available for the pre-hospital management of acute myocardial infarction. I am referring to aspirin, and I understand what you might be thinking. Doctor, aspirin, that common everyday medicine? Yes, precisely that. 1. But allow me to elaborate on why and how it functions, because once you grasp its mechanism, you will never again underestimate the power of a single aspirin tablet. Recall my earlier explanation. During a heart attack, the primary issue is a clot, predominantly formed by platelets, that obstructs a coronary artery. Platelets are those tiny blood cells that rush to the site of a plaque rupture, attempting to repair the perceived injury. Aspirin, whose active ingredient is acetylsalicylic acid, possesses an extraordinary property. It irreversibly blocks the activation of platelets. It achieves this by inhibiting an enzyme called cyclooxygenase 1, COX-1, which is absolutely fundamental for platelets to aggregate and stick together. To put it simply, aspirin effectively tells your platelets, stop accumulating. It deactivates the very mechanism that is constructing the clot that is slowly strangling your heart. The clinical evidence supporting aspirin's efficacy is unequivocal. The ISIS-2 study, one of the largest trials ever conducted on heart attack patients, conclusively demonstrated that the early administration of aspirin reduced mortality from heart attack by approximately 23%. This remarkable finding means that nearly 1 out of every 4 patients who would otherwise have died survived thanks to a single tablet taken promptly. A 23% reduction in mortality from a medication that costs mere pennies is nothing short of revolutionary. Now, it is crucial to administer aspirin correctly because if it's taken improperly, a significant portion of its life-saving effect can be lost. How is it taken correctly in this acute context? The recommended dose is 300 milligrams. A standard 500 milligram aspirin is generally too much. So if that's all you have, you would use half a tablet. A child's aspirin of 100 milligrams might be insufficient. Ideally, you should have a 300 milligram or 325 milligram aspirin readily available at home. And here is the crucial detail that makes all the difference. You must chew it, not swallow it whole. Chew it thoroughly. Why is this so vital? Because when you chew aspirin, it disintegrates in your mouth, allowing for partial absorption through the sublingual mucosa under the tongue and the oral lining. This dramatically accelerates its entry into your bloodstream compared to swallowing it whole, where it must first pass through the stomach and intestines. We are talking about a difference of precious minutes in its bioavailability, and as you now know, every minute counts immensely. Chew it as if it were a cracker, then swallow. It's that simple. However, important warnings must be issued because this is medicine, and in medicine, nuances save lives. Who should not take aspirin? Firstly, individuals with a known allergy to aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs. If you have ever experienced an allergic reaction to aspirin, do not take it. Secondly, those with an active peptic ulcer or active gastrointestinal bleeding. Aspirin can worsen bleeding and should be avoided in such cases. Thirdly, people who are already taking anticoagulant medications, such as warfarin, Sintrom, acenocumarol, or newer oral anticoagulants like apixaban or rivaroxaban. In these situations, adding aspirin without specific medical guidance can significantly escalate the risk of severe hemorrhage. For these reasons, and this is advice I consistently give during consultations, discuss with your doctor during a routine checkup whether you should keep aspirin at home for a potential cardiac emergency. Let your doctor be the one to recommend it for your specific case, based on a calm, informed assessment of your medical history. But if you are a person without these contraindications, no allergies, not on anticoagulants, and you experience the symptoms of a heart attack with aspirin at hand, chew it. You will gain invaluable time while waiting for emergency services to arrive. There's one more point I feel compelled to mention here, as I often encounter misleading information circulating on social media, which deeply concerns me. There are videos and posts that advocate taking other analgesics like ibuprofen or diclofenac instead of aspirin. This advice is incorrect and potentially dangerous. Ibuprofen, in fact, can interfere with aspirin's antiplatelet effect, and some studies have even associated it with worse outcomes in heart attack patients. Neither ibuprofen nor paracetamol nor any other painkiller should be used in this context. In the setting of a heart attack, the only option with robust scientific evidence is aspirin. Remember this vital piece of information and share it with your family. The third technique is perhaps the most misunderstood and also the one that generates the most confusion, largely because of a persistent myth that has circulated online for years, from WhatsApp chain messages to viral videos. This myth promotes a technique presented as the one doctors don't want you to know. I am referring to the so-called cough CPR. I intend to discuss this with complete honesty because my role is not to tell you what you want to hear, but to convey the truth. The theory behind cough CPR suggests that if you feel you are about to lose consciousness during a heart attack, you should cough repeatedly and vigorously. The idea is that coughing generates a contraction of the chest, which briefly increases intrathoracic pressure, potentially maintaining a minimal blood flow to the brain for a few precious seconds. This concept originated from an article published in 1976 describing maneuvers applied to monitored patients in hospital coronary care units under direct medical supervision in the immediate seconds following the onset of a severe arrhythmia, an absolutely controlled environment. What transpired afterwards is a common phenomenon online. This specific niche data point was extrapolated, oversimplified, and went viral, reaching millions of people as if it were a universal, life-saving technique to be used at home. The reality is quite different. The American Heart Association, the European Society of Cardiology, and the Red Cross are unanimous in their stance. Cough CPR is not recommended as a first aid technique for the general population during a heart attack. There are several weighty medical reasons for this clear consensus. Firstly, a myocardial infarction, a heart attack, and cardiac arrest are not the same thing. A heart attack is an arterial obstruction. Cardiac arrest is when the heart ceases to beat in a coordinated, effective manner. Coughing might have some theoretical role in imminent cardiac arrest, but not in the heart attack itself. Secondly, coughing vigorously when your heart is already in distress can actually increase the oxygen demand of the heart muscle, potentially worsening the situation. Thirdly, if you are already unwell enough to be on the verge of losing consciousness, it is highly improbable that you will be able to cough effectively or vigorously enough to make a difference. And the fourth, and perhaps most critical reason, if you are contemplating coughing instead of immediately calling 112, you are squandering the most valuable time you have. So cough CPR is emphatically not technique number 3. Technique number 3 is something entirely different and is equally well supported by physiological understanding. It is called the heart load control breathing technique. Allow me to explain why it works. When you experience a heart attack, panic is a completely natural primal response. Your brain detects an existential threat and immediately activates the sympathetic nervous system, the famous fight or flight system. This triggers a cascade of hormonal releases, primarily adrenaline and noradrenaline. These hormones, while useful in other dangerous situations, do precisely the opposite of what your heart needs in this moment. They increase your heart rate, elevate your blood pressure, and significantly augment the oxygen demand of your heart. All of this means that when panic takes hold, your already injured and struggling heart is forced to work even harder. It's akin to demanding a car with a malfunctioning engine to accelerate to its maximum speed. Controlled breathing, conversely, activates the parasympathetic nervous system, the opposing system, responsible for rest and digest, and promoting calm. This occurs through what is known as the vagal reflex. Slow, deep, and deliberate breathing can effectively reduce your heart rate, slightly lower your blood pressure, and decrease the oxygen demand of the cardiac muscle. It is not a cure, it is not magic. But in those critical minutes while you await the ambulance, it can make the crucial difference between a heart that is working less strenuously and one that is rapidly exhausting itself. How is this technique performed? It is remarkably simple and is known as the 4-7-8 technique. While maintaining the modified Fowler's position I previously described, seated, back supported, knees bent, gently close your mouth. Inhale slowly and silently through your nose for a count of 4 seconds. Do not force the breath. Let it be gentle, as if you are delicately smelling a flower. Then, hold your breath for a count of 7 seconds, remaining calm and without tensing your body. Finally, exhale slowly and completely through your mouth for a count of 8 seconds, making a soft whooshing sound, as if you are gently blowing out a candle placed a meter away. Repeat this cycle of 4-7-8 breathing over and over again. As you breathe, mentally repeat a reassuring mantra to yourself. I have called 112. They are on their way. I just need to stay calm until they arrive. This is not empty self-suggestion. It is neuroscientific wisdom. Internal language profoundly modulates the activity of the nervous system. Studies on pain management and acute stress consistently demonstrate that individuals who maintain a calming internal dialogue experience less severe physiological responses to distress. I must share another compelling story, that of Doña Consuelo, a 72-year-old patient who had lived alone for 8 years since the passing of her husband. She was a retired teacher, an exceptionally sharp and well-prepared woman. Doña Consuelo had attended one of my public talks on cardiovascular health and had diligently taken notes. She had even programmed the 112 emergency number into the first speed dial slot on her phone. One Wednesday afternoon, she began to feel pressure in her chest. Immediately, she recognized the symptoms. She called 112 within 2 minutes of symptom onset. She then walked to her front door, unlocked it, sat down in the armchair in her hallway, and calmly waited, breathing slowly and deliberately. When the paramedics arrived 9 minutes later, Doña Consuelo was conscious, fully oriented, and her pulse was remarkably stable. She was transported to the hospital by ambulance, underwent an angioplasty, and within 72 hours, she was calling me to recount her experience. She told me something I will never forget. "Doctor, the only thing that kept me calm was knowing exactly what I had to do. Fear did not win because I had a plan." That, my friends, is the profound power of knowledge. It does not eliminate risk, but it grants you an opportunity that you would otherwise never have. Before concluding, I want to address the most common and dangerous mistakes people make during a heart attack, because sometimes knowing what not to do is as crucially important as knowing what to do. Error number 1, driving yourself to the hospital. Never, under any circumstances, should you do this. If you are alone and suspect you are having a heart attack, do not get behind the wheel of a car. Firstly, the physical and mental effort of driving significantly increases cardiac load, putting an immense strain on an already compromised heart. Secondly, if you lose consciousness while driving, the outcome can be catastrophic, not only for you, but for others on the road. Call 112 and wait for the ambulance. Emergency medical services arrive with essential monitoring equipment, defibrillators, and highly trained personnel capable of providing immediate care. A private car offers none of these life-saving resources. Error number 2, waiting to see if it improves. I have stressed this point already, but I will repeat it because this mistake is a killer. If your symptoms persist for more than 5 minutes and are consistent with the descriptions I've provided, do not wait. Do not rationalize that it will pass on its own. Every single minute of waiting means precious cardiac muscle is irreversibly lost. Hesitation in this scenario is a direct threat to your survival. Error number 3, drinking water or eating anything. In the context of a heart attack, consuming anything by mouth can pose a significant problem if emergency surgical intervention becomes necessary, as a full stomach complicates anesthesia and increases the risk of aspiration. Nothing by mouth, with the sole exception of aspirin if it is indicated for your case. Error number 4, engaging in physical exertion. The thought, "I'll just walk it off," or "a little movement might help," is a dangerous misconception. Absolutely not. Any physical exertion increases your heart's demand for oxygen, which is precisely the last thing your compromised heart needs at this critical moment. Sit down, remain still, and focus on your breathing. Error number 5, not opening the door. As mentioned earlier, the time emergency crews waste attempting to gain access to your home can be the difference between life and death. Always unlock or open your door before they arrive. Finally, there's a crucial piece of information that most people are unaware of, but which medical professionals recognize as vital. Many heart attacks do not strike without warning. In approximately 50 to 60% of cases, the body sends distinct alarm signals in the hours leading up to the event, sometimes even days in advance. These are known as prodromal symptoms, and learning to recognize them can provide you with the invaluable opportunity to seek medical help before the emergency fully materializes. What are these critical warning signs? First, inexplicable and disproportionate fatigue. This is not the ordinary tiredness you feel after a long day. I am referring to a profound, debilitating exhaustion that doesn't correspond to your recent activity level, appearing relatively suddenly in individuals who don't typically experience such fatigue, particularly prevalent in women. This is one of the most common and most frequently ignored pre-heart attack symptoms. Second, chest discomfort with exertion. If in recent days you have noticed that climbing stairs, walking briskly, or carrying groceries produces a pressure or heaviness in your chest that you hadn't experienced before, this is a significant alarm signal that demands urgent medical attention. This condition is known as unstable angina, and it is a frequent prelude to a full-blown heart attack. Third, difficulty breathing without apparent cause. If you find yourself becoming breathless while performing activities that you previously did with ease and regularity, your heart might be signaling that something is not functioning correctly. Fourth, unusual insomnia coupled with anxiety. Several studies indicate that the activation of the autonomic nervous system in the hours preceding a heart attack can manifest as difficulty sleeping or a diffuse sense of restlessness and unease without any identifiable external cause. Fifth, frequent or irregular palpitations. When the heart is under stress or at risk, it can sometimes generate arrhythmias that the individual perceives as irregular heartbeats, skipped beats, or an accelerated heart rate for no apparent reason. If you experience any of these warning signs, especially if they occur in combination, do not wait for the situation to escalate. Call your doctor, go to the emergency room, and request an electrocardiogram, EKG. An EKG can reveal subtle changes indicating that the heart muscle is under stress or suffering even before a full heart attack occurs. And in that crucial window of time, medical professionals can intervene to potentially prevent the heart attack from happening at all. The heart attack that is prevented is, unequivocally, the best kind of heart attack. I want you to leave this reading with 3 critical pieces of information seared into your memory. The first, if you experience the symptoms of a heart attack, call 112 or your local emergency number immediately. Unlock your front door and sit down in the modified Fowler's position with your knees bent and your back supported. Do not lie flat, do not drive, and do not wait. The second, if you have no contraindications, no allergies, no active bleeding, not on anticoagulants, chew a 300 milligram aspirin tablet. Chew it thoroughly. Do not swallow it whole. The third, practice the 4-7-8 breathing technique. Inhale for 4 seconds, hold for 7 seconds, exhale for 8 seconds, and continually reassure yourself that you have done the right things, that help is on its way, and that you only need to remain calm. These 3 actions, just these 3, possess the profound potential to save your life. There is one recurring sentiment that I take away from every patient who survives a heart attack. It is a phrase that is repeated in various forms, but always conveys the same core message. I wish I had known this sooner. Today, you do know, and that, in itself, is already a victory. Please, share this invaluable information with someone you care about. Your partner, your sibling, a friend who lives alone, your mother, your father, because the information you have just received holds no true value if it remains confined to this page. Its true power lies in reaching and empowering more people. If you haven't yet subscribed, I encourage you to do so now. Every week, I publish videos specifically designed for you, covering prevention, medications, healthy habits, and how to effectively navigate the healthcare system once you are over 60. And remember, please leave a comment, a 1 if you found this valuable, or a 0 if you believe there's room for improvement. Your feedback helps me more than you can imagine. This video content is intended solely for educational purposes. The information presented here does not substitute for consultation with your physician, nor does it constitute a diagnosis or prescription. In the event of any symptoms of a cardiac emergency, call emergency services immediately. Always consult with your healthcare professional before taking aspirin or any other medication.